Cystic Fibrosis Foundation Compass presents Navigating CF, a series of informational videos for people with CF, their families, and caregivers. In this video, we'll take some of the confusion out of insurance terms and look at the key words that affect what you'll pay out of pocket for health coverage. You'll find additional videos and more information in this Health Insurance for CF series on the Navigating CF playlist. Almost every part of your health insurance plan will influence how much it will end up costing. From other videos in this Navigating CF series, you will learn that you can pay less to see a doctor who is in your plan's network, and that the cost of your covered medications depends on your prescription plan's tier structure. Now, let's look at the key insurance terms that go into what the bottom line will be. The premium is the amount you will pay every month to keep your plan active, whether or not you need care. This amount stays the same for the coverage year, but can change from plan year to plan year. It's important to review premiums during open enrollment every year. Then there's the deductible, or the amount you must pay before your insurance begins making payments. For some services, such as preventative care, insurance will pay even if you've not yet paid your deductible. You can find out more about what's considered preventative care at healthcare.gov. Some plans have a separate deductible amount or even waive the deductible for prescription medications. And depending on the plan, there may be separate deductibles for individuals and for families. Family deductibles can be aggregate or non-embedded, meaning all members of the family can pay toward the family deductible without a limit to the amount one member can pay towards that deductible. The plan won't make any payments for any family member until the family deductible has been reached. In family deductibles that are embedded, the plan begins to make payments as soon as one member has reached the individual deductible. However, the rest of the family members must reach their individual deductibles to start using the plan benefit. Each family member cannot contribute more than the individual deductible amount. Carefully review your plan's summary of benefits and member handbook to learn how your plan's deductible works. Your plan may charge you a copay when service is covered. A copay is a fixed dollar amount, for example, $25, that you will pay for each covered service or prescription. In most cases, copays do not count toward your deductible. Copays vary from plan to plan and may also vary between services. Your plan may have a coinsurance for covered service or prescription. Coinsurance is a form of cost sharing, like a copay, but it is the percentage of the cost you will pay after reaching your deductible. For example, you may pay a 20% coinsurance while your plan pays 80%. Depending on the plan, there may be a combination of copay and coinsurance structure based on the type of covered service. Keep in mind, the medical and pharmacy benefits of a plan could have separate deductibles and cost sharing. Finally, the out-of-pocket maximum is the most you will pay for covered services during the coverage period. After the out-of-pocket maximum is reached, the plan pays for 100% of all covered services for the remainder of the coverage period. Keep in mind that you could have a separate out-of-pocket maximum for prescriptions and out-of-network coverage if your plan has out-of-network benefits. There are other terms to be aware of as well. Two of these are copay accumulator and maximizer. These can increase cost and administrative burden for people with CF and their families. Many people with CF who take high-cost medications rely on copay assistance programs to help offset the amount they pay out of pocket for those medications. Copay accumulator describes a restriction a plan may have to limit applying copay assistance payments made on your behalf toward your deductible and out-of-pocket maximum. For example, if your manufacturer copay card program can cover all of a $500 copay except $10, only the $10 you pay will count toward your deductible and out-of-pocket maximum, increasing your cost burden. Some plans have maximizer programs, which are a bit different. They shift drug costs to manufacturers. Usually, these copay maximizer programs apply only to certain drugs, and those drugs are handled separately by a third-party company. This company will bill the maximum allowable amount of a manufacturer's copay card and then cover the remainder. This keeps your costs at zero or a low amount throughout the year. If your medication is subject to a maximizer program, the cost paid by the copay card will not count toward your deductible or out-of-pocket maximum. And although your cost is kept at zero or a very small amount, maximizer programs may be complicated to navigate and can add significant time and administrative burden. An increasing number of states ban accumulator programs, so depending on where you live, you may be shielded from these cost increases. However, people with CF who have employer-based coverage that is self-funded should be aware that self-funded plans are exempt from these state laws. It's important to know if accumulator and maximizer programs are part of your insurance plan and how they could pose coverage challenges that could affect your care. You'll find more information, tools, and resources about the cost of health insurance, including a plan comparison checklist on cff.org/insurance and in other videos in this series. And remember, Compass Case Managers are ready to help. Connect with us whenever you're looking at new health insurance plans.